Hi guys, welcome back to Dr. Shane's channel. How are you today? So today I'm going to talk about one of my most traumatic experiences that I've had as a medical doctor so far. And this happened, I would say maybe around 4 years ago. So we had a patient that actually came in for a brain tumor surgery, and she was in her 40s, late 40s at the time, I think between 47, 48. And she came in for what I believe was a frontal brain tumor that we were going to resect. She was coming in and out a lot from the hospital because sometimes her labs weren't fully normal for her to do surgery, and then we had sometimes space with intensive care unit to have a space for her after surgery as well. So when she came in and we finally got the space, she was unfortunately cancelled because she ate the morning of the surgery. And the funny thing about it is that she ate Doritos because she thought that that wasn't classified as food for surgery, or food that you shouldn't eat for surgery. So she ate Doritos plus she had something to drink. So we unfortunately had to send her home and then bring her back. Brought her back in, reorganized the entire surgery, and surgery went well. Did the surgery, got out I believe over 90% resection of the tumor, went to ICU, intensive care unit, did well after. During that period went back to the ward, was doing well actually. And we were on the verge of getting her home. I remember one evening, she started to feel a little short of breath. So we examined her, did her chest x-ray. Chest x-ray was normal. Her chest sounded good. Her stats were between 93 to 95% on room air. Gave her a small support of oxygen just to help her, sat her up in the bed just in case she was having any post-operative complications. And she was feeling better. A couple hours later, we got a call from the nurse on the ward that she went to the bathroom, went back into her bed, and has now gone fully unresponsive, meaning that she's not obeying commands, she's not hearing us, she's not doing anything, even when we stimulate pain. So we rushed back to her to examine her to realize that she didn't have a pulse and wasn't getting any accurate vitals, and we actually started resuscitation. And this happened within her level of going from conscious to unconscious happened within seconds. So we got there very quickly, did our resuscitative period, and unfortunately she passed. She didn't make it. And it was just I guess it was a lot for the team because she went through surgery, everything went well, and then she just suddenly went unresponsive just like that. And despite us trying so hard to bring her back around, she didn't make it. And I guess that shows you how much you have to appreciate life for what it's worth, appreciate what you get to do each day, where you get to go, thanking God for every day that you get to call it another day, because life is short and you really just have to enjoy life as you go through. I think her case as well was more traumatic for me because it was a surgery that we had enjoyed doing. It was a surgery that participated in, got to take out the tumor, got to help with close out, watching her through her recovery period, which she did well in. It was traumatic because it was one minute of just talking to her and all was well, and the next minute of her just going fully unresponsive, like in the blink of an eye she was no longer there. And I guess that was traumatic because of it just brought to me how quick life can pass you by, how quick you can lose life. We did speak to her family after. They did understand that surgery has complications, but they also took it hard because of how sudden the death was. And what we thought happened could have been that she may have had a pulmonary embolism, or she may have had an MI. We did tests which didn't really link towards an MI, so we were probably thinking it could have been a pulmonary embolism. But the whole experience of just watching her go from just actively underwater talking to us to just fully unresponsive, and despite resuscitative periods passing away, was a lot for myself and along with the team to take in as well. Being in the medical field, or if you want to get into the medical field, death is going to be something that you are going to see at some point in your career. Unfortunately, hopefully sooner than later, and that's because it helps you to cope. Yes, there is the thing that as you see more deaths in your career, you at some point kind of get a little bit immune, and your emotions at times can get detached. What I would say is, one, whenever you have your first death experience, like for me, anybody who dies, whether I've treated them or not treated them or I'm around there, I always say a small little prayer for them. However, if it's your first death and you're unsure, there's always someone who you can talk to, whether it's your superiors or if your work environment supplies a counselor for you to talk to. It's always good to talk with somebody or talk with a family member if you want to, or if you're, however you're comfortable. You don't have to give details or personal details, as you know, because of confidentiality agreements, but it's always good to talk to somebody, to express how you feel. It's always good to take it off your chest and not to bottle it in. Two, as you become more developed in the medical field, you're going to see more deaths, you're going to see more complications, and you want to be able to cope with them as you go through, but also not become fully emotionally detached where you don't have that human factor. It's always good to understand the family's point of view, because families will take a sudden death a lot harder than a death that has been coming along. In terms of, if you have a family member who has had, for example, a long-standing illness, and you know down the road they're getting weaker and they're getting worse, as a family, the family gets to come along, the family gets to interact with that individual and help them through that process as they're going through. And the family kind of gets accustomed to understanding what's happening with that patient, what's going on. And if they die, then yes, it is a sad moment, but the family is a little bit more comfortable and understands what was taking place. And if it's a loved one who died unexpectedly or who died suddenly in an accident or so. So when you talk to families, you also have to understand how you approach them and how you speak with them. They can be somewhat comfortable when you give them the unfortunate news.